Gallstones are solid, pebble-like deposits of digestive fluid that form inside your gallbladder. It is estimated that 1 in 10 adults have gallstones. They can be one of two major types: cholesterol or pigment. The majority of stones are cholesterol. They range in size from as small as a grain of sand to as large as a lime. Some develop just one gallstone, while others may develop many. Most people with gallstones do not develop symptoms. Sometimes, gallstones may cause pain or other complications and must be treated. Your gallbladder is a small, pear-shaped organ located inside your abdomen under the liver. It is connected to both the liver and the intestine through a tube known as the bile duct. The liver produces bile continuously. This is a greenish-brown fluid. Bile is needed to digest and absorb fatty food. The primary purpose of the gallbladder is to store and concentrate bile. When you eat, fatty food in the small intestine causes the gallbladder to contract and empty the bile into the intestine. There are several factors that can increase the likelihood of developing stones. Your bile may contain too much cholesterol. Normally, there are enough chemicals to keep the cholesterol soluble. If there is an increase in cholesterol excretion, this will exceed the capacity of these chemicals. The excess cholesterol will first form crystals and eventually stones. The level of bilirubin in your bile can increase. Bilirubin is produced when your body breaks down red blood cells. In certain conditions, this production may increase. This excess bilirubin may then form stones. If your gallbladder doesn't empty correctly, this can cause stagnation and concentration of bile. This too will favor stone formation. There are many conditions that can increase the chances of developing stones via one or more of these pathways. Gallstones are commoner in women. Oral contraceptive pills also increase the risk of developing stones. The risk of gallstones increase with age and peaks around 40 years. Obesity, frequent fasting, and a rapid weight loss can cause gallstones. If you have an abnormality in your red blood cells, like sickle cell anemia, you are at a higher risk of developing stones. Lack of physical activity and diabetes mellitus will also increase your risk. There are several complications you may develop due to gallstones. These include acute cholecystitis, which is an inflammation of the gallbladder, blockage of the bile duct, blockage of the pancreatic duct and inflammation of the pancreas, and cancer in the gallbladder. The majority of people who have gallstones will not develop any symptoms. Their stones remain silent. These are often identified on scans done for other reasons. If a stone gets stuck in your gallbladder and prevents it from emptying, you may develop a colic. This is a severe, intermittent, cramping pain in the upper right part of your abdomen. You may also develop nausea and vomiting. After you've had your first attack, there is a good chance you will have more episodes in the future. These could be more severe and occasionally associated with complications. Because of the stones, your gallbladder may get inflamed. This is known as acute cholecystitis. You will develop a persistent, aching type of a pain in your abdomen. You may develop fever as well. This is a serious condition and requires immediate treatment. If you've developed cholecystitis, you need to have surgery to remove your gallbladder. Sometimes, a stone may leave the gallbladder and enter the bile duct. This may lead to several complications. If the duct gets blocked, you may develop jaundice, a yellow discoloration of your body because of an increase in bilirubin. The blockage can also cause an infection in the bile ducts. This is known as cholangitis. You will develop pain, chills, and fever. This requires prompt treatment to remove the stone. Occasionally, a stone may cause inflammation of the pancreas, known as acute pancreatitis. If you develop any of the following features, you need to meet a doctor immediately. Severe abdominal pain, high fever with chills, yellow discoloration of your skin and your eyes, or vomiting that doesn't settle. You will require investigations to both confirm that you have gallstones and to identify any underlying cause. The commonest way to confirm the presence of gallstones is with an ultrasound scan. Having gallstones does not necessarily mean that they are the cause of your symptoms. If there is any doubt about the relationship between your symptoms and your stones, you will need additional tests. If your pain is not the characteristic pain due to gallstones, or if you have symptoms suggestive of gastritis, you may need an esophagogastroduodenoscopy. The doctor will also perform some blood tests to look at your level of hemoglobin and bilirubin and other liver function tests. There are several options for managing gallstones. They depend on your symptoms and the underlying condition. If your gallstones are not the cause of your symptoms, we can simply watch and wait. If the gallstones are causing symptoms, you will need surgery to remove the gallbladder with the stones. Surgery to remove the gallbladder is one of the commonest surgeries performed. This will be done under general anesthesia, where you're not awake. Most of these will be done as laparoscopic surgery, also known as keyhole surgery. The surgeon uses a camera to see inside your abdomen and uses special instruments to perform the surgery. This is a very safe surgery and you can live a normal life without your gallbladder. There are several things you can do to reduce the chances of developing gallstones. You need to maintain a healthy body weight and be physically active. You should avoid frequent fasting or a rapid weight loss. Try to stick to regular meal times every day. You must ensure that you have a balanced diet with the recommended level of fat and cholesterol. You should also take food that is high in fiber. If you would like to know more about this or have any questions, please leave a comment below. You could also comment on any topics you would like me to cover in the future. Thank you.